Nurses are feeling overstretched and undervalued, with nearly half saying that they've considered quitting the profession since the pandemic began.
That is according to a major new survey by the Royal College of Nursing. We'll be speaking to its chief executive in just a moment. First, let's hear what these nurses had to say about their experiences of the last few months.
I just recently qualified in October, so it's been a bit of a scary time for us newly qualified nurses, you know.
At first, it was just so confusing because even the information we had about this coronavirus wasn't clear.
I think the peak of the pandemic was very, very hectic and chaotic. That's how I kind of describe, because there were a lot of uncertainty for us.
Nobody actually knew, are we doing this right, or are we doing it wrong?
I've never been involved in anything like this, very, very first time. So I was really also stressed and worried what's going to happen.
When the pandemic actually hit and when we were at a peak, the number of patients really overwhelmed us in intensive care unit.
So I was coming home sometimes in the car and just crying the full way home.
I suppose, mental health stresses that we were under, lots of people were very concerned. We all were very concerned about family at home.
If I've had a bad day at work, or if I see something on the TV and it's negative and I feel that fear that we're going to go back into that second wave, I can't help it. I just get this really bad anxiety, and even now I'll really struggle to try and relax and get some sleep after that, but I'm just trying to take it one day at a time.
So it's been quite hard for everybody, not just myself, but we came together and we've became stronger as a team and as a wee family, so I'm dead proud of us all.
Let's speak to Dame Donna Canary, who's the Chief Executive of the Royal College of Nursing. Very good morning to you. It's really interesting. I mean, that was just a snapshot of a few voices of nurses and how they're feeling right now. It leaps out at anyone looking at your survey to see that a half of those you questioned are now thinking about quitting or have thought about quitting during the pandemic. What do you make of that?
Well, it's true. More than half are saying that they feel like quitting, partly because they've been through such a stressful time. And actually what nurses have done is demonstrated their professionalism in a way that has never been seen before, certainly not during my lifetime. They have stepped up and they have served their patients. Remember, we started this pandemic with 50,000 less nurses than we should have had. And actually, even though we had many volunteers, we weren't able to effectively utilise them all. So actually, over 50% of nurses said that better staffing levels would make them feel valued. But more importantly, 73% said improved pay would make them feel more valued. And we know that this profession has been neglected in terms of pay for far too long. So we've seen the clapping, we've seen the appreciation, and we value that. But it is time for the government to now step forward and give nurses the pay increase that they deserve.
Is it your sense then that the politicians have been happy to pay tribute to nurses and recognise the work they've been doing, but have not stepped up to the plate in doing something tangible, and according to this survey, something that would make a tangible difference, not only to pay packets, which in itself is worthwhile, but making them feel like they are doing a job that is worthwhile and that's being recognised?
Well, I think the country has seen how hard nurses have worked during this pandemic, and therefore it's only right that the profession and the work that they do is valued and recognised. I mean, they were on the front line, putting their own lives at risk, and actually it exposed for all the actual intense and hard work that nurses do. So I think, yes, it's been fantastic, but we can't just rely on clapping. The public has shown its appreciation, but the government needs to now step up and show its appreciation.
Can I just, could you finish that sentence for us? In a way, it's or what?
Well, I think we've really seen from our survey that actually many nurses are thinking of quitting the profession. So we know that the pandemic is not over. We know we need them. As you heard from those nurses that spoke earlier, they themselves are terrified about a second wave or what is to come in the future. But they have still professionally continued to serve. But what we do not want to do is go into another pandemic with people quitting our profession. And we know that over the last 10 years, that has been happening. People have felt that with the responsibility that they are holding is not commensurate with pay, and they have preferred to go and work in a supermarket. We lose all those valuable skills and knowledge that we need to care for the patients in this country.
Are you worried about the knock-on effect to recruitment?
Well, you know, the government has said that we have more people showing an interest in nursing, but what we know is that actually when you're starting with such a deficit and it takes 3 years to train a nurse, we cannot afford to lose any more. So we don't want anybody walking. And what nurses have clearly told us is that pay makes them feel valued, but also so does safe staffing. If we want to maintain the staffing, even at the levels they are now, we need to make sure nurses are paid properly.
Now, we know that frontline nurses have been very hard hit by the pandemic themselves. And I remember right at the beginning of all the problems, there were stories of nurses who contracted coronavirus, who very sadly died, and that has been ongoing. But alongside that, what about the stories of day-to-day behaviour and what they're having to deal with and cope with?
Well, I think every single day that you go into work, you are actually having to cope with the coronavirus and people that have the coronavirus. But don't forget, during this period of time when the NHS actually wasn't providing normal services, we've had many other things that have happened come to light. We know that we've got to work far harder to make sure that the cancers that have been diagnosed are treated, and many, many more diseases that have gone unnoticed or not dealt with. So actually, there is so much more work to be done. So we've not only got the COVID-19 happening at the moment, but everything else is being piled on top. So actually, if nurses are already saying there's a huge impact on their well-being, they don't have enough staff, the support that the government need to put in now is both of those things.
Dame Donna Canary, thank you very much for your time this morning. Donna Canary is Chief Executive of the Royal College of Nursing, talking about that report about how nursing staff are feeling in the pandemic. In amongst is that statistic that over half are thinking about quitting because of what's been happening.